The intersection of drug abuse and homelessness in California, a comprehensive analysis. California faces one of the most severe homelessness crises in the United States, with the state accounting for more than 1 in 4 people experiencing homelessness and over half of all unsheltered individuals nationwide. This crisis represents not merely a failure of housing policy, but a complex public health emergency where substance abuse, mental illness, and systemic failures intersect. Understanding the intricate relationship between drug use and homelessness is essential for developing effective interventions and policy solutions. The scope of California's homelessness crisis. Between 2015 and 2019, unsheltered homelessness in California rose by 47.1%, while statewide homelessness increased by 30.7% during the same period. These figures reflect a growing crisis that has only intensified in subsequent years, driven by a combination of economic pressures, inadequate mental health services, and the escalating availability of dangerous synthetic drugs. California's homeless population is distinct in its demographics and circumstances. Recent studies have identified that the state's homeless individuals are disproportionately affected by trauma, mental health conditions, and substance use disorders. The University of San Francisco found that 72% of individuals experiencing homelessness had experienced physical violence during their lifetime, while 82% reported having experienced a serious mental health condition at some point. These staggering numbers indicate that for most people, homelessness is not a singular event, but the culmination of multiple compounding adversities. Substance abuse, a primary contributing factor. Substance abuse stands as one of the most significant predictors and consequences of homelessness. According to data from the California Policy Lab, substance abuse of drugs or alcohol was a contributing factor in the loss of housing for 51% of unsheltered homeless individuals. This figure is consistent with broader research indicating that nearly 2/3 of homeless individuals report having had a period in their life in which they regularly used illicit drugs, while 62% report heavy drinking. The relationship between drug use and homelessness operates in multiple directions. For some individuals, substance abuse precedes and contributes directly to housing loss by impairing employment capacity, depleting financial resources, and damaging social support networks. For others, homelessness itself creates conditions that precipitate or worsen substance use, as individuals living on the streets may turn to drugs as a coping mechanism for trauma, exposure, and the daily stress of survival. Marin County research has identified substance use and misuse as occurring both before and after individuals become homeless, suggesting a cyclical relationship that complicates intervention efforts. The same study emphasized that mental health struggles frequently stemmed from extreme childhood trauma, including abandonment, with substance use often emerging as a maladaptive coping strategy. The devastating role of fentanyl. The opioid epidemic has transformed the landscape of substance abuse among California's homeless population. Fentanyl, a synthetic opioid 50 to 100 times more potent than morphine, has become the leading cause of death for Americans aged 18 to 45. For the homeless population, who already face elevated health risks, fentanyl presents an existential threat. The drug's potency and low cost have made it ubiquitous on the streets, and its availability has contributed to rising overdose deaths in encampments and shelters alike. The powerful opioid creates a cycle of addiction that is exceptionally difficult to break, often requiring extended treatment and support that homeless individuals cannot readily access. Additionally, the combination of fentanyl with other substances, often without the user's knowledge, increases the risk of fatal overdose. Mental health, the inextricable connection. The link between substance abuse and homelessness cannot be understood in isolation from mental health conditions. Over half of unsheltered homeless individuals report that mental health conditions contributed to their loss of housing. The University of San Francisco study found that 27% of homeless individuals had been hospitalized for a mental health condition, with 56% of these hospitalizations occurring before their first experience of homelessness. This chronology is significant, as it indicates that untreated or undertreated mental illness frequently precedes housing loss. Schizophrenia, bipolar disorder, severe depression, and post-traumatic stress disorder can impair an individual's ability to maintain employment, manage finances, and sustain relationships. When these conditions are combined with substance use, the risk of homelessness increases dramatically. The Marin County research further emphasizes the role of past trauma in shaping both mental health and substance use patterns. Participants frequently reported histories of severe childhood trauma, including abandonment, physical, and sexual abuse. These early adversities create pathways to homelessness through their effects on mental health, substance use, and social functioning. Conclusion. The relationship between drug abuse and homelessness in California reflects the intersection of individual vulnerability, systemic failure, and the devastating impact of the opioid epidemic. While substance abuse is a primary contributing factor to homelessness for approximately half of unsheltered individuals, it is rarely the sole cause. Mental illness, trauma, poverty, and the lack of affordable housing combine with substance use to create pathways into homelessness that resist simple solutions. Meaningful progress requires moving beyond ideological debates about harm reduction versus treatment-first approaches to develop integrated, flexible systems that meet individuals where they are while providing clear pathways to recovery. The crisis in California's streets, parks, and encampments demands urgency, compassion, and a willingness to invest in evidence-based solutions that address both the symptoms and the root causes of homelessness. Without such investments, the human toll of this crisis will continue to mount, measured in lives lost to addiction, mental illness, and the brutal conditions of unsheltered living.